episode of Recharging the Human Battery Radio. I'm your host, Dr. Stefano Sinicropi. Excited to be here today. We're on AM 950 radio, and this is a topic that is so important and so relevant, and there's so much going on in this particular field that I wanted to dedicate an entire episode just talking about this particular topic. So you guys that follow the show, you get that what we are trying to do on this program is really think about ways to educate the population, educate the medical community, potentially on things that can really help people with their health and wellness. And a lot of it is outside the traditional kind of barriers of medicine, which again is amazing for so many different things, especially acute conditions, traumas, this and that. But for chronic conditions and some of the things that ail us as a species, we just need better solutions. So one of the things that I have been unbelievably turned on by as far as giving people the ability to heal themselves more naturally, ways that are not using medications or surgical therapies, is regenerative medicine, and that is the use of stem cells. Now, just imagine a world where we can harness the power of your own body's healing ability to get you maximally improved in so many different areas that affect us, anywhere from osteoarthritis to autoimmune diseases to all kinds of things, chronic pain, psychiatric disorders, neurological conditions. I can go on for a long time, but I mean, thinking about things like this is really, really exciting, and regenerative medicine has come so far. Now, when I say the word, stem cells, some of you might just be thinking, oh my God, this is a bad word, stem cells, embryos, this and that. So, there's a lot of controversy that occurred back in the 90s about embryonic stem cells. That is not what we're talking about. In fact, any research that has been done with embryonic stem cells has actually mostly fallen, to kind of flat on its face. The problem with embryonic cells is that they can become anything. So this is not what we're talking about. We're talking about either harnessing your own cells to give back to you in various areas, whether it be very specific or whether it be through your whole body to inspire healing and recovery, or utilizing things like placental stem cells, which are dramatically less controversial. And I will tell you, even the Catholic Church is behind the use of those type of stem cells, because those are products that created. It's not like, we're saving those or anything. You just take the placenta and it essentially gets thrown away. So there's really nothing controversial about this. And I'm going to talk about some of the reasons why we are moving so slow in the stem cell world, but hopefully really get you guys excited about what the actual results are, like what's being done and how we can really help, people with stem cell therapeutics. And it's something you're going to be hearing a lot about. It's going to be everywhere. There's specific reasons why it's really slowed down. You're going to hear a lot of misinformation. Misinformation really holds people back from getting the care and treatment they need. I'm going to talk about that on the other side of the break. And it's really, utilizing stem cells as a treatment is a decision that really you should be offered. These things for so many different conditions. Some we can do, very easily in the United States. We're going to talk about some of the policies that are in place right now that prevent us from using some of these technologies. But there's so much that's available right now that can help you and your families to really heal and to get better. So when we get back on the other side of the break, I'm just going to kind of take you on a journey, on the stem cell journey, talk about what it is, how they're used, and what the future might look like. So we will see on the other side of the break. I'm Dr. Sinicropi. This is Recharging the Human Battery Radio. We are on AM 950, and we will see you after the break. All right, welcome back to Recharging the Human Battery Radio. I'm your friendly orthopedic spine surgeon host, Dr. Stefano Sinicropi. We're on AM 950 radio, and this is a topic that I hope you're all tuning in for. It's really, really important. So you're going to hear terms like regenerative medicine. What does that mean? I mean, there's different buckets of regenerative medicine, but the big one in regenerative medicine is going to deal with the utilization of stem cells. And again, on the other side of the break, we started getting into some of the controversial aspects of stem cells that relate to embryonic stem cells and cloning of those things. And again, those can become anything. So that's not really what we're going to be talking about. So just take anything that has to do with embryos, controversy, picket lines, all that stuff. Let's get that off of our minds, because that's not what we're talking about. We're talking about real science that is going to make a huge impact in people's lives. And so let me talk about my own personal journey for a second. Now, I will tell you that over the course, I've been practicing 20 years, and I obviously have made a big change in the way that I think about managing so many different diseases, and have gotten into biohacking and peptide therapies and stem cells and all these other things. But before I sort of really opened my mind to what was out there, all those things that I was not I just was not privileged enough to learn in medical school, because these things are really not taught. Now, regenerative medicine is going to start being taught big time in medical school, because it's just going to be part of how we treat patients, period. But obviously at the time that I was there, it was not being taught. It was extraordinarily controversial at that time. And but anyway, there's been a big dramatic shift. So I could tell you, in my 20 years of practice, there have been so many patients that have come to me talking about traveling out of the country to have stem cell therapies. And I'll be the first person to say it, and I say this very publicly. I mean, I've said it on social and I've said it on other things. Because of the siloed mindset and the fact that I'm also a human being and I trained in a certain way, I really was blowing off a lot of these things. And, I had seen, in fact, there had been some controversial stuff that happened here in the Twin Cities as well. And it's interesting because a little bit of I'll just call them fake controversies, but again, these things were really the flames were really fanned by the media and some other things, because again, you get a great story like that. Oh, this doctor's doing this or this doctor's doing that, and then it turns into a big deal. And I mean, this is years and years ago, and so obviously I'm surrounded by all this, and I'm also in a profession that's very siloed. And so at our clinical meetings and things like that, these are a lot of these topics we don't talk about. And so patients were coming to me and they were saying, hey, I want to go to Panama. I want to go to Mexico. I want to go here and there to get these stem cell therapies. And I'm not even talking about for, like Parkinson's disease. I'm talking about they were going to get stem cell therapies because their knee was hurting or they had back pain. And to be honest with you, I was blowing them off and trying to counsel them not to do it because, why would you spend that money and travel overseas and do all these other things? And so, I mean, you talk about doing a 180 on my part. So when I started getting into the world of, biohacking and different integrative healthcare and integrative medicine, it was a natural thing to look into other therapeutic options for my patients. And so when I ran into my former partner, Dr. Louis Sager, who's now my partner in our stem cell clinic here in the Twin Cities, we started really getting into this discussion on stem cells. And to be honest with you, I didn't even know that he was doing all these stem cell treatments. It's very interesting. That I didn't even know that, because I, was referring him patients, and he really was doing it, and he was getting all these referrals and having these incredible outcomes. So when I talked to him about helping us out with some other things, and we started talking about regenerative medicine, it was a no-brainer to go down that path. But the thing that impressed me the most was the results he was getting, but more importantly, it got me into looking at the research studies, like, for example, in patients that have severe knee arthritis. The research is it's pretty amazing. what the outcomes would be, and he was demonstrating those same outcomes. And so again, you guys have heard me talking about how my transformation, what a crazy transformation I had with things like light therapies and peptides and all kinds of other stuff that I honestly didn't believe in at all because I didn't know anything about it. I was blown away by what the possibilities were in regenerative medicine and using stem cell therapies. And again, when I talk about stem cell therapies that we're doing here in Minnesota, I'm talking about things that are allowed under the FDA. None of this stuff is FDA approved, but it's fine. The FDA, why would they have any problem with your own cells being introduced into your own body? There's no rejection potential. The side effects are minimal, and most people don't have any side effects, and so there's no reason. Now, the other types of stem cells, which is utilizing like placental tissue and other things, there is really pretty significant regulation, and the FDA has its stance right now. But I can tell you it's changing because the laws have just recently changed in Florida, and this is going to happen, across the country. We'll talk about that a little more. But again, getting back to my own thing, so I went from literally telling people, what are you, like, you're flying where to do what? Well, I'll see you back, start like even, being a little sarcastic. And I know you guys get that from when you go see, doctors and stuff like that. They're like, okay, well, we'll see you back for surgery then in 2 months when, you get back from your fancy trip, like things like that. Now, that's not my personality. So I hope I wasn't coming off that way. If I was, I'm sorry. That's just not my personality. So that's rare, but certainly I was acting in a position where I felt like I was protecting patients from going and basically, wasting their money or being in another country where, for some reason they had some complication. Like, what are you going to do? I would ask, like, what are you going to do if something happens without even understanding what even the risks were? And again, we get into these like silos, and it's bizarre, these biases that we have. We all have them, but like just because you're an expert in one thing doesn't mean you're an expert in the other thing by definition, because it's in that general, basket. For example, if you're a quarterback in the NFL, it doesn't mean you understand, like how to be a punter and all the techniques of being punter just because it's football. It's in the same game, but that's how a lot of us, unfortunately act as providers. Anyway, went from that to now, being part of an amazing stem cell center here, the Center for Regenerative Medicine, that is in Edina. But more importantly, I always talk about this, about people trying to influence or just kind of trying to change people's mentality and how to approach, how to approach medicine, how to approach their own health. And I say with the influencers, we have to be really, really careful because, again, a lot of these people don't have anything at stake. So they could say anything. They could say, oh, yeah, this vitamin is going to change your life, right? If it doesn't, like, what happened? Nothing. There's nothing at stake. They're not answering to boards or anything like that. So I'm very, very careful in anything that I say or get behind, because as a physician, we have, number one, it's our reputation. Number two, we have people to answer to because we have to make sure that we're really above board and doing things. But after, really doing the research on these, what we call autologous stem cell therapies, and doing a deep dive and then getting involved in projects and really starting to take care of patients and seeing these procedures done and seeing these outcomes, I went from, oh my God, I can't believe you're wasting your time and your money doing that, to doing a TED Talk, which just happened a couple of weeks ago down here in Minneapolis. I did the Minneapolis TEDx, and that was on stem cell therapies and the amazing impact they can have on spinal conditions, and talked about how, for example, in degenerative disc disease and those types of things, or injuries to the spine, stem cells are a tremendous tool to help people potentially avoid surgery, decrease their pain, increase their mobility, etc. We also talked about in that TED Talk, how spinal cord injuries are going to be really approached by utilizing stem cells in conjunction. And I think I've talked about that here on the show as well. Tremendous studies out of both Yale and the Mayo Clinic here locally, which showed really, really significant improvement in a majority of patients who receive stem cell therapies for spinal cord injuries. So it really is the future of medicine, and I'm really, really excited about the future. And in fact, very, very shortly, and you guys will see this coming out, I'm actually interviewing the founder of the stem cell clinic in Panama, who's doing amazing work. His name is Neil Riordan. We're doing an in-person podcast in LA in this beautiful studio. And we're going to be talking about kind of the history of stem cells, how they got started, why they ended up being in Panama to do these more like placental stem cells. And we call them day zero stem cells because obviously it's the first day of life. And those stem cells can in some ways be more powerful. In some conditions, for me as a physician looking at the research, I don't think it's absolutely necessary. But for some of these other global, severe diseases, I think that day zero stem cells are going to be amazing. So you'll see that podcast coming up. I'm really excited. And the work that they're doing, he was actually on Joe Rogan because he treated Mel Gibson's dad and had Mel Gibson on there. It's a phenomenal story. And they treat so many, like the who's who in America that go down there to Panama. So it's really exciting to have an opportunity to talk to him. That's going to be like a 3-hour show. We're really going to dive into all the ins and outs of stem cells. But the fact that a lot of these treatments now are available here in the U.S. and patients don't know it. So when I talk to my patients now about potentially looking at stem cell options that are available here in the U.S., and again, Flores expanded their parameters, but their patients are so excited to be able to potentially, avoid surgery and decrease their pain because there's so much suffering in the world. I talked about it in my podcast when it comes to my specialty, spinal conditions. It's a billion people. 1 billion people worldwide are affected by back and neck pain. That's a lot. That's a big number. And it is pretty devastating to so many lives. So what if instead of, kind of focusing on all these medications that we're giving people and surgery, now a lot of people unfortunately do need surgery because you're not going to fix a horrible, structural problem with stem cells, but stem cells can be used in conjunction with surgery to help these patients. So again, went from, this is a bunch of nothing, like and then again, once again, we have to check ourselves. Once we do the research, once we look at the data, I couldn't be more excited for the future and, plan on, volunteering for all kinds of, legislative sessions and other things where we really try to pave the way to allow some of these more advanced techniques to be done here in the United States and do it all under the supervision and the guise of the FDA and, the other, bodies like HSS. But we've got to go in this direction. It's really it's tragic that we are not offering some of these treatments. So let me take you down so stem cells. So for those of you that don't know what a stem cell is, I mean a stem cell, I'll just give you the basics of it. When we think of stem cells, it's like a cell that can become something else. Okay. And the classic ones are stem cells that are found in the embryo, right? Those cells can become anything. They can become a heart, lung, liver, a nerve, whatever. So those are called basically those are everything cells. Okay, multipotent. They can become anything. Then there's like pluripotent stem cells, which can become, as you get older and older stem cells, they can become some things, but it's limited. And then there's an entire tree and diagram that's actually confusing to us as physicians, and it takes a lot of studying to get all this stuff. Then you get to mesenchymal stem cells, which we use here in the United States with great results, which is taking cells from either your bone marrow or your fat. Now these cells are more differentiated, right? These are adult cells, right? Or even we can do this also in younger people, but let's just say for an adult, these are adult stem cells. So these are called mesenchymal stem cells. They live around these blood vessels. And when you have an injury, like you cut your finger, they rush to the area and they start doing their work. So stem cells are a huge part of why when you cut your finger and you watch it over a week, why that skin heals and everything rebuilds. That's those stem cells coming in there like first responders doing their magic. It's really magic. So on a larger scale, that same thing that's happening with your little cut healing is what's happening if we take a bunch of stem cells basically from your bone and inject them into an area of injury. They're doing the same thing. We're just putting them in a huge number, and then they're doing their magic to heal in that area. Now, how are they doing their magic? They're not becoming the thing. It's not like, my partner, Dr. Sager, who I've done a podcast with him. He's like, oh, I'm a stem cell and I'm going to magically become all these other things. He does it a lot. He's a lot funnier than I am, so I'll let him, do all that stuff. But anyway, they don't magically become other things. The way that these stem cells work is that they actually are like a living pharmacy, and it's just fascinating. So they have like this GPS signal. So things are amazing. Like, I was always fascinated. This is one of the reasons I got into medicine, and I loved biology and chemistry and all these other things. It's like, how does anything even happen? Why do certain things happen? Why when you have an injury do all these certain cells go there and start rebuilding? We don't know. Well, here's an interesting thing. They actually have an internal GPS so that it guides them. No different than, certain types of, like retriever dogs, right? They have a certain scent. And so when you want to retrieve something, they can smell it from who knows how much away, and they go right to it, right? It's just innate. And so these mesenchymal stem cells have an innate ability and a GPS signal that hones in on areas of damage. And so when you introduce these cells into a body or into a human body or an animal body or whatever, then they absolutely can then sense and detect. They can, quote unquote, see the area of damage or the chemical SOS signals of where things are broken, and they go there. And so what do they do when they go there? When they go there, when they go there, they basically become part of that environment. And so that process is called homing. Right, they're homing in on something, or I like to just, the easy way, like just to remember it, is they're going to their home, which is where the problem is. Once they get there, they set up like these command centers, like a chemical pharmacy, and they're not becoming something. So, for example, if we're using them to help with like a bad cartilage, bad knee, like an osteoarthritis, where you've got like damaged cartilage, damaged bone, they're not making new bone. They're not turning into bone cells or cartilage cells, but what they're doing is that they are setting out these little tiny messengers telling all the other cells around them what to do and telling them to decrease inflammation and start healing. Healing from within, and it's absolutely fascinating. And again, when you have that little cut, that just doesn't happen magically. There's something going on there, and this is what's happening, right? Now, there's other clotting factors and all kinds of other stuff. We don't have to get into that, but it's really those stem cells that are orchestrating the whole process, and it's fascinating. And so we can do this on a bigger scale. So if you have a horrible, for example, shoulder or knee, or you have a bad spine, or then, more systemic issues, you can introduce these stem cells, and then they'll do their work to decrease inflammation either locally or in the entire body, depending on how they're delivered. So that's the short answer. So just so that you know what we're talking about. So let's talk about the history for a second. So interesting, stem cells, okay, were coined. The term was first coined in 1888 by these two German zoologists, right? So much stuff comes from studying in animals, and their names were Theodore Boveri and Valentin Hacker. And these are cells, and they saw these cells, and they're like, wait a minute, these cells are self-renewing and differentiating, and clearly these were more kind of on the embryonic or earlier stem cells. But then in the 1950s, we started doing bone marrow transplants, with the first successful one being done in 1956 for leukemia. So basically, we were taking the bone marrow cells, and then we were curing things like leukemia, which is amazing. And obviously, bone marrow transplants, most of you have heard of that. Those are done for many conditions now, and obviously has saved millions of lives across the world. So then we go further. Let's fast forward into the 1960s. So these other stem cells from the bone marrow would then start being used for certain types of blood disorders. And so there was something, before we had HIV, we had something called severe combined immunodeficiency syndrome, and that was something that was treated with human bone marrow transplants. Again, stem cells doing their work. And then by the 1970s, these mesenchymal stem cells were starting to be, identified in cells that could do a certain type of job around the bone and cartilage and fat, and they were the key to musculoskeletal repair. Then we started looking, as time passed in the 90s and the 2000s, at placental stem cells from afterbirth. And the reasons that these were really important is because they can proliferate really fast, and so that means divide, right? So stem cells from day zero divide way, way faster than stem cells from a 50-year-old, okay? It's a completely different thing. And you guys know from compounding interest, if you're making 3%, per year on your money is very different than making 70% per year on your money, which is where you would, consider a stem cell from the placenta. So they grow. I mean, you can grow those in the billions and billions very, very rapidly compared to our own stem cells. But anyway, they were first utilized, like these mesenchymal stem cells, to repair the heart after heart attacks with really interesting really interesting results. And then there's all this other work. This guy, Yamanaka, okay, he got the Nobel Prize for programming stem cells, mesenchymal stem cells, back to embryonic-like state. So in other words, giving them even more things that they can turn into. Now, again, for the conditions we treat here in the United States, it's not relevant, but now looking at other things where you can take stem cell, like you could take literally skin stem cells and then transform them into types of brain cells, which can help people in Parkinson's disease and a lot of disease. Again, a lot of diseases are being looked at this way, and there's going to be a lot of Nobel Prizes coming down the road for these stem cell, researchers. And so I just wanted to take you through a history of where, kind of where this all came from, going all the way back into, to 1888. It is crazy what we've done in the last 150 years. We went from knowing nothing to kind of having these massive medical centers that can do all these different things. It's just fascinating. One of the things that really drew me into this field. So the global stem cell market right now is about 14 billion, and it's going to at least double by 2030. And to be honest with you, these are projections done by these organizations. I think that that's ridiculously conservative. I think some of the assumptions there are some of this misinformation that's out here is going to continue to be pervasive, but I don't think that's the case. I think that as we really start recognizing and seeing the sometimes incredible turnarounds in really sick patients, I think that eventually enough physicians are going to jump on the stem cell bandwagon, and we're going to push it forward much faster. If we think of things that are out there, okay, I want to now, we've kind of talked about the background in stem cells, and to be honest with you, I need about an 8-hour podcast if we really wanted to get into it. And again, I have this 3-hour podcast coming up with Neil Riordan. And that's probably not enough, but we will get through a lot more than we have. But I want to go through some from very specific conditions, and I want to start with two things that we can treat right here, right now. So osteoarthritis, and talk about some of the results. It affects at least 32 million adults in the United States. It's a lot of people. That's 10% of the population. Again, these estimates underestimate how bad the problem is. It's billions and billions of annual cost, way over, 100 million. And then you have tendon issues that sideline, tendon and other injuries that sideline athletes. And then you have the big one, degenerative disc disease and spinal conditions. It's just massive. It is massive. So many people, are suffering. Millions and millions of people suffer from chronic daily pain. That means every day they're in pain. And osteoarthritis, injuries, and spinal conditions are biggies. They're huge. They're a huge part of that, of people just, suffering. So let's talk about some stuff. So in a study for knee okay, osteoarthritis. This was done in 2023. I'm just going to throw some stuff out there. I could do this for hours, but I just pulled a couple studies. There was huge pain reduction. So on a visual analog scale score, they went down by a couple of points average, but that means some people were way better than that. 80% of the patients were better at 1 year. That's a huge number. Okay, let's compare that to some other things. But anyway, in a meta-analysis of 20 trials, they looked at different kind of arthritic conditions. Pain and function improved by roughly up to about 30%. And that's a huge number. So these are just things to take into account. And if we went into like looking at tendon injuries and other things, which are a huge problem, if you look at the animal studies, there are so many that show a 50% faster healing of tendons if you put stem cells near them. This is a big deal. And so when I talk about these things and I talk about them to physicians and I say, hey, you should be looking at this as a potential treatment option, and they're not excited about it, I'm like, well, what are you excited about? I don't know what you're excited about. Can you please let me know what you're excited about? And maybe that's the factor. I just don't know. When we look at spinal conditions, there was a great meta-analysis done in 2023 of 608 patients. I actually quoted this in my recent TED Talk, but it actually dropped something called the Westry Disability Index by 12 to 13 points, which is really good. It showed increase in disc height in degenerative disc disease. But here's the big one. 2 years later, almost 70% of those people had significant pain relief. This is huge. I see patients all day, every day that have back pain. Yes, some of them we could do surgery on, and some of them, need other things. But then when you compare these longer term improvements to things like epidural steroid injections, which do have downsides because they can break down cartilage and other things, it is almost baffling why we are not offering this, to more patients. So I think that when it comes to the world of arthritis and injuries to tendons and muscle injuries and things like that, and then spinal conditions, I don't know of anything that's more of a no-brainer if patients are able to afford it, or if they can get into a trial where they can do it. Regardless, it is something that they should absolutely look at, and them not at least being afforded the opportunity to consider it, to me is not a great thing, and that's something that I'm going to bang the drums on. I mean, I think people really need to consider it and think about it, and then we mix it with other regenerative options like peptide therapies and light therapies and stuff like that. It's even more powerful, and these combinations are absolute. I'm telling you, they're going to change the way that medicine is delivered. And I can tell you, for me and my family, that's the direction we would go in if there was an issue. Again, this isn't medical advice. You have to consult with providers, or happy to come and see me if you happen to be in the Twin Cities area. But I just tell you what I would do, for myself and my family, and which direction we would be going in before looking at other types of more invasive options or medication-based options. Okay, so those are the things that can be offered today here. You don't have to go to Mexico. You don't have to go to Panama. You don't have to go to God knows where to have these things. Those clinics, I'm not saying they're not great, but between flights and staying there for a week and being in a foreign country and having to do all these different things, you could just have it here in your backyard or whatever state you might be in. There's some centers now. Not everyone is doing it, to the same level. What differentiates our centers from others is we do bone injections, which have a significantly different type of impact in longevity and preventing knee replacements, shoulder replacements, things like that. And then we do like complete motion segments in the spine, which is very unique, only clinic that's really doing that kind of stuff. But you can find clinics other places in the country that are doing these things. But again, please at least explore these if you or your family are suffering from the conditions we just discussed. Now, the topic that gets a bit more tricky, let's just say, because there are regulations. And I'm telling you, like the FDA and HSS, we're really going to expand this. We just need a regulatory framework. For those of you that are into crypto, you've heard so much about Bitcoin and Ethereum and all these other things, and how the thing that's really impacted is not having this regulatory framework. So we have to develop a better regulatory framework. And again, that's something I'm excited to really get involved in, because we need these treatments. So now when we talk about utilizing placental stem cells or day zero stem cells, these are cells that really you can pick and choose, and right. So if you have 10 placentas, you can say, okay, we're going to look at these cells from the 10 placentas. Then you can choose the best 2 or 3 that are the most robust, that are producing the most chemicals that you want, and then you can replicate those lines, and you can use them systemically. Okay, so where are they being used? So again, I'm going and meeting with. A pretty famous guy that runs the Panama Stem Cell Institute, where they're doing a lot of these things. And so they are using it on things like autoimmune disorders, and the results are very, very interesting. So, we've already been using bone marrow transplantation, okay, which is very different. But what about just injecting these stem cells systemically and trying to improve that? They're being used in neurological conditions, psychiatric, disorders, but just generally failure to thrive. They're being done. I mean, if you guys do the research, you'll see a lot of these folks out here that are trying to live longer lives and have better longevity. They are going to get, some of these more systemic stem cell therapies. And again, a lot of them are not available here in the United States yet, but they are very close to coming. And I'll keep you guys updated, because it's something that we are certainly going to be incorporating into our clinical practice. But again, this has to be in conjunction with all the regulatory, bodies. But again, there's almost not a type of condition that's not being looked at. I met with this Dr. Jean Laure. We did a podcast together. She is part of a team that is taking skin stem cells, converting them to brain stem cells that can produce dopamine, and then injecting them into the area of the brain to try to fight against Parkinson's disease. It's really fascinating. So there's so much being done both here in the United States and all over the world. And it's like, there's going to be, the updates are going to be coming fast and furious, and I'll try to keep, everybody, updated on these things. But again, there's things you can have here in the United States, and it's great. You should stay here to have them. There's things that you might have to go abroad. Again, I'm not going to necessarily condone those, so you have to do your own research and talk to them. I'm not the one that's doing it, but it's fascinating. When it's available here, I'll be talking a lot more about it as we have our regulatory framework. Now, in the future, I will tell you that these stem cell advocates are really looking at extending potentially lifespan, extending organ life, just using it in personalized medicine to just make people better. So one of the things you're going to hear from the podcast that I'm doing is when Mel Gibson's dad got treated. He was 92 years old, and he was very frail, and he was not doing well. And Mel Gibson, a bunch of his friends had gone down already to get, these stem cells, and he had heard about it, and his friends were like, oh, you should take your dad. You should take your dad. So he's like, okay, I'll take my dad. So they flew him down there. And his turnaround was so dramatic. I'm not going to spoil it, because that podcast comes out well after the show. But he lived to 102 years old, right? And Dr. Riordan, who I'm going to be interviewing, went to his 100th birthday party, and the guy's like zipping around doing great. Okay? This is what our vision of the future, should absolutely be. So I think that I'm really hoping to be part of this movement, both for lay people that are looking to improve their healing and wellness, but also as one of the real advocates from the orthopedic community, from the spine community that is out here at least putting these therapies on their radar, because I want my colleagues to be doing these things, or at least exploring it, thinking about it. This isn't about competition. This is about bringing the best technologies to the masses so that we can really fight against our horrible chronic disease problem. And the big one is, in pain in there, and then everything else, which is really not getting better despite throwing a ridiculous amount of money at this problem. So on the other side of the break, I'm just going to close it up with some of the, kind of the thoughts and ideas about how we're going to start incorporating some of these other things down the road. This is Dr. Sinicropi, Recharging the Human Battery. We are on AM 950 radio. And we will see you on the other side of the break. Okay, welcome back to Recharging the Human Battery Radio, where we've had an episode where I hope that you guys understand that stem cells, it's not a dirty word. You can say it. It's okay. Say it with me. Stem cells. You'll be fine. And there's so many opportunities to utilize stem cells, in ways that can benefit you and your families. And I hope that you learned a lot on the show. Again, with these, 1 hour programs, I just want to give you guys a sense of what's out there. I hope when my, TED Talk comes out that you guys, watch that. Probably in a couple months, that'll be released. It takes a while for TED to get those things out. But, I could not be more excited about regenerative medicine. And you talk about skating to the puck, right? It's overused, but if you guys are in the medical community out there, or you guys are students or looking to do research on anything, I'm telling you, you want to skate to a puck? Skate to the world of regenerative medicine and stem cells, because it is going to be so big. And I love talking to young people. They get so excited about this stuff. And interestingly, a lot of younger people tend to know more about regenerative medicine than kind of my contemporaries. I don't really know why that's the case, but they tend to know more about it, and they tend to be more excited about it. So I want to finish with kind of this. The U.S. regulatory framework absolutely needs to change. So right now, I'm just going to summarize. If you're interested, your own body stem cells, autologous stem cell treatments, your own body stem cells going back into your own body, the results are really strong and getting stronger, especially for things like arthritis, for spinal conditions, tendon regeneration, things like that. So this is available now. Stay here in the United States and you can get your treatments. When it comes to utilizing placental tissues and then cloning those, again, those are things that if you're interested, again, I'm not endorsing it. I'm not doing anything. It's just something that I'm very excited about. That is something where there's these amazing, clinics that you can do, research on. Again, I mentioned the Panama Stem Cell Institute. Again, I have no affiliation with them. I'm not trying to promote them. There's others out there that you can look into. You just have to make sure that they are absolutely above board. They have amazing labs. They do good clinical research, et cetera. Be very, very careful with how you choose that. So when we look at that, we really need to monitor, and as the physicians that are pro stem cells, we need to be at the table. So we need to be sitting down with the powers that be in Washington, D.C., and then here locally at the legislative level, really pushing these technologies. Two more things. Florida legislation now has changed. This happened July 2025. Very exciting news, because this is going to start happening. So I'll just read. So it allows physicians to offer non-FDA approved placental stem cells for orthopedics and wounds if it's from accredited sources. Okay? Again, no embryonic cells, which is fine, because embryonic cells have not shown good, not for those things. And so that shouldn't be. So it allows the expansion ethically of these things. It's a huge, huge deal that Florida has done this. Okay, are you listening, Minnesota legislation? Because I'm coming, and we're going to talk about this. And then the last thing, right to try policies. Very exciting. So 41 states have some version of right to try, which means it permits unapproved stem cells to be used in terminal and chronic conditions. Okay? This is kind of loosely worded. We need to do some more work with the legislation here in Minnesota and look at some of the legal and regulatory framework. But if we're able to bring some of these, adult and placental stem cells that are cloned for some of these diseases and do it for people that have chronic diseases that ain't ever going to get better. A lot of these autoimmune diseases, or if they have a terminal illness or they have chronic pain that's never going to get better, those types of things. It is huge. So I'll give you guys an update as I learn more and talk to, more of our legislators here about, what's happening with that framework. So here's the final. Stem cells can be hope for millions. I'm excited about it. Do your own research. Ask your physicians about the possibility if you have those conditions we talked about before. And please continue listening into this show because I'm going to be giving updates on a regular basis. This is Recharging the Human Battery. I'm Dr. Sinicropi, AM 950 Radio. We will see you next week.